So the first learning objective was to understand how measurement of health, social care provision informs.
Please, can you make it a full screen?
Yeah,
So that
I'm
we
trying that. No worries, I'm trying that. Yeah. Yeah. So, we in this learning objective, we actually talked about what health data, health-related data is. We talked about what epidemiology is, how mortality patterns vary, what's infant and morbidity, mortality, how do we measure them. Then we talked about social care related data, such as birth and death rates, data relating to mental health and mental capacity, children's social care service statistics. We also talked about the importance of demography. So demography was the study of uh, persons of the population. So we talked about change in population size, age profiles, race, ethnicity, regional differences, and distribution of population. Trends for wider groups, how this demographic data is linked to planning, making predictions, resourcing, and staffing services. Some statistical terms that we had talked about, that I had given you an assignment, a short assignment, where you had to calculate mean, median, mode, percentages, and rates were also there. And then how do we read and interpret health and social care related statistics, use and abuse of statistics. A bit about epidemiology. So it focuses on how diseases spread and affect populations, with a focus on identifying patterns, causes, and risk factors. So the different study designs that we talked about, the different statistical measures where we use to analyze data. And this is done, actually, the data helps us to make future interventions, and then in order to prevent or control spread of diseases such as smallpox or all these epidemics, all the data that we've had from these epidemics, they actually help us in preventing further epidemics or the spread of epidemics. So mortality, we talked about, it's the number of deaths of in a given population in a specific time period. It's important to know because if there's an increased number of deaths occurring because of any reason in any type of population, because we break it down by age, sex, and other factors, we then know where to focus all our resources. And then we talked about infant mortality. So it was deaths of babies within the first year of life. So it's expressed as a rate, and the number of deaths under 1 year of age per 1,000 live births. It's very important to know that the reasons for the most leading causes for infants can die of many reasons. There can be accidents, there could be birth-related defects, but the most common ones we talked about were prematurity and low birth weight, birth defects, infections, and SIDS, which is known as sudden infant death syndrome. Morbidity rate we talked about. So morbidity is the prevalence. Prevalence means old as well as new cases, and incidence is new cases of illness or disease in a population. So morbidity is often, it's measured by as a number of cases of a particular disease or condition per unit of population, usually expressed as a rate or a percentage. It's an important indicator. We talked because then it again helps us in prioritizing. So we talked about certain modifiable risk factors and certain risk factors that are not modifiable. So genetics, we talked about that you can't change your genetics, but you can actually change your environment, your behavior, and your other social determinants of health, like your job, your education, etc. Demographics we talked about is a study of the characteristics of human populations, which include their size, age structure, distribution, and composition. So it's an important field of study in many areas, including economics, sociology, and public health. So we talk about age distribution here. We talk about gender distribution regarding diseases, for instance, regarding deaths, for instance, regarding health and other social outcomes. Ethnicity and race, we talked about geographic distribution and socioeconomic status. So this all is the study on, this comes under the study of demographics. We talked about birth and death rates. So it's a measure to track the number of births and deaths in a population and to monitor over time. So births are important indicators, so you know where you're going to use your childcare services most. Mental health is very important. So mental health can data, whenever you have it, it can be used to evaluate the effectiveness of intervention. So whenever you're using interventions, your data is always going to be used. So whether it's in any sort of interventions, whether it's mental health, whether it's, for instance, if you're doing diabetes screening, you're using an intervention, your previous data will be the one that you will make use of the most. Mental capacity, we talked about such people lack mental capacity, such as dementia. So you would want to focus all your efforts and your resources on those vulnerable population. Then we talked about adult social care outcomes framework. It is a set of indicators used to measure and monitor the quality and effectiveness of adult social care services in England. It was introduced in 2011 by the Department of Health and Social Care. It includes a range of measures that cover key aspects of adult social care, including quality of life of people who use services, their safety, and the effectiveness of care and support, and their experience of care. Then we talked about the 4 domains within when we're talking about ASCOF itself. So it's enhancing quality of life, delaying and reducing the need for care and support, ensuring people have a positive experience of care and support, and safeguarding adults whose circumstances make them vulnerable, and protecting them from harmful some avoidable harm. Then we talked about this video. We saw this video where it was we saw the importance of healthcare data and research. So healthcare data or research helps us in identifying health and social care needs, monitoring and evaluating performance, planning and resource allocation, supporting research and development, supporting policy development. We talked about, this is what we've just discussed now. So demography, we've talked about all of this. We talked about median. So median was the measure of central tendency that represents the middle value in a set of data. It is calculated by arranging all the values in a set of data in a numerical order and identifying the middlemost value. So if you don't have a middlemost value, if you have 2 values, for instance, if you have 6 measures, so how do you calculate that? So you take the mean of the middle 2 values, and then whatever you have is that mean is actually the median. So it will have fractions, it will be in points. Then we talked about mode, which is it has the value that occurs most frequently in a data set. Percentages are a valuable way of expressing a proportion or a rate as a percentage of the total. Rates are a measure of frequency or occurrence of an event that in a specific population over a specific period of time. We had mortality rates, we had morbidity rates. So whenever you have these statistical terms, if you understand them, you can interpret data in a better way. We talked about this. I hope you've done this. We can also calculate percentages, rates, and when you're reading and interpreting health and social care data, it's important to understand the context. What is it talking about? Recognizing limitations. So every data will have limitations. Looking at trends, is it an increasing trend or a decreasing trend? What does it relate to? Comparing groups, and be aware of uses and abuses. So that's about LO1. Any questions from learning objective 1? I know I'm hurrying a bit, but I'm conscious of time. So I'm making sure that our objectives are complete, but most of all, our assignment discussion is complete. So I'm just aiming for that. My main focus is there. Any questions, please interrupt. Feel free to interrupt in between. So I'm sharing my slides for learning objective 2. So this was to understand the roles and of health and social care practitioners. We talked about different practitioners. There were doctors like GPs, there were nurses, there were social care providers. So we'll talk about what their roles are. So we talked about roles and responsibilities of various people who are employed within the health and social care sectors. We talked about what partnership working is, what team working is, the multidisciplinary working is, effective partnership working, the importance of communication, identifying and reducing barriers, understanding boundaries, contracting, roles and responsibilities, relationship between health and social care. Healthcare practitioners were defined as professionals who work in a healthcare industry, and this is to provide medical care to patients. They are trained to diagnose, treat, and prevent illnesses and injuries, as well as provide ongoing care and support to their patients. So we had examples like physicians, nurses, dentists, pharmacists, physical therapists, occupational therapists, speech language pathologists, and many others. So what are they involved in? So there are different roles of different practitioners. So there's some who have diagnosis and treatment roles, some have preventive care, some have care coordination, and some have advocacy functions. And some are working as support workers, some are working as record keepers. So we talked about all the different NHS careers, and um, and then we talked about nursing. So registered nurses, we've talked about they're essential professionals, and they play a crucial role in promoting, maintaining, and restoring health, as well as preventing illness. So the main functions in roles include assessment, planning and implementing care, patient education, advocacy, and documentation. Then we had occupational therapists, who focus on helping individuals with disabilities, injuries, or illnesses to regain or maintain their ability to perform daily activities and participate in meaningful occupations. Their functions included evaluation, intervention planning, therapy implementation, client education, collaboration, and documentation. Most of their works, they overlap different um, key workers have an overlap in their work, nature of work. Then you have social workers who are responsible for providing social, emotional, practical support to individuals, families, and communities. They work with individuals who are experiencing difficult life situations like illnesses, poverty, unemployment, and abuse. Social workers assess clients' needs and develop plans to help them access resources like housing, healthcare, and financial assistance. Some of their responsibilities include assessing the client's needs, providing counseling and support, advocating for clients, collaborating with healthcare professionals, developing and implementing treatment plans, and providing education and resources. General practitioners, such as doctors, they diagnose and treat medical conditions in patients. They may have a special, they may be general in their practice, or they may be cardiologists, neurologists, or pediatrics, which is specialist in their own fields. Some of their responsibilities are conducting physical exams and medical histories, diagnosing and treating medical conditions, prescribing medications, collaborating with healthcare professionals, educating patients. Pharmacists are healthcare professionals who specialize in medication management. They work in various settings, including pharmacies, hospitals, and clinics. Some of their responsibilities include dispensing medication, conducting medical reviews, educating patients, collaborating with healthcare professionals, managing medical inventory. Physical therapists are healthcare professionals who specialize in rehabilitation and physical function. They work with patients who have MSK or neurological conditions and affect their ability to move and function properly. Some of their responsibilities include assessing patients' physical abilities, developing and implementing treatment plans, educating patients, collaborating with healthcare professionals, monitoring patient progress, and promoting patient independence. Then we talked about identifying key features of effective partnership working, which was a second part of this LO. So we have, so whenever we have a shared partnership, it is always there are several key features included in this effective partnership. So it's shared goals and values, clear roles and responsibilities, so everyone knows what the other has to do or what they have to do, and the other person knows their whatever their boundaries are. Effective communication, trust and respect, joint decision making, flexibility, commitment, and investment. So team working and multidisciplinary teams. Sometimes we work in various disciplines. If there's a team, there are various disciplines that work in the same team. So this is known as partnership working and teamwork. There's partnership working. It's a broader concept that refers to collaboration between different organizations, agencies, or sectors, such as healthcare and social care, to improve outcomes for patients, families, and communities. Effective partnership working involves building trust, communication, and mutual respect among partners and working together to achieve shared goals. Teamwork, on the other hand, involves collaboration among individuals within the same organization. So that partnership working is broader. It's more collaborating with different organizations, but the teamwork is mostly within the same organization or department to achieve the same objectives as a partnership working does. Multidisciplinary working involves collaboration among different professionals, different people. We've talked about all these roles. So if there's no multidisciplinary team, your work will always be slow because one person cannot do the work of the other. So effective partnership working. So it is very important to have effective communication, identifying and barriers and reducing them, understanding each other's boundaries, contracting roles and responsibilities should be clear. We talked about outlining the relationship between health and social care. Yeah. So overall, effective partnership working requires a high level of communication, collaboration, and coordination among partners. By working together effectively, health and social care professionals can provide more comprehensive and coordinated care. So these were the references. Any questions? I think this is pretty simple, what we've just talked. If there are no questions, I'll go to this third learning objective. So, let's start sharing my screen again. So the third learning objective was to understand the inequalities in health and social determinants. We talked about different inequalities that may exist within the health and social care. We talked about the reasons why these determinants exist, or these inequalities exist. So health determinants, their age, sex, hereditary factors, lifestyle, social and community networks, socio-economic, cultural and environmental factors and conditions, nature and nurture. Health and well-being inequalities for different social groups based on social class, race, ethnicity, gender, geographic region, including rural and urban living, disability, age, vulnerable groups in society, or inclusion health groups. So there you may have vulnerable migrants, you have gypsies, you have Roma and traveler communities, rough sleepers, and homelessness, sex workers. We talked about what health determinants are. So they refer to various factors that influence an individual's health status and can contribute to the onset of illness or disease. These factors can be biological, environmental, social, or economic, and can vary in their level of influence on an individual's health. So some common health determinants which we talked about were genetics, there were environmental factors, lifestyle factors, social factors, healthcare access, and quality. So we talked all about this, all of these factors. Yeah, we've talked about them. So socioeconomic factors can impact lifestyle choices and access to healthcare, which can in turn affect overall health outcomes. Understanding the complex interplay between these factors is critical to promoting health and wellness at both individual and community level. We talked about the social class, how in health inequalities affect them, and what are the contributing factors. In the same way, we talked about race, ethnicity, gender, geographic region, disability, age, vulnerable groups. It is important to note that all these factors, they're all interrelated. We talked about the web of causation, or we talked about the very intertwined factors, that they're so interconnected that you can't separate them from each other. So if you want to address these inequalities, it's critical to understand the underlying factors and to develop policies and interventions, because if you do not understand the underlying factors, you can develop policies, but they'll not be effective. They'll not have the impact that they should have. Social classes. So if there's a low socioeconomic class, they'll have lack of access to healthcare, lower quality of education, higher levels of poverty, exposure to environmental toxins. We talked about their housing, their discrimination and marginalization. Race and ethnicity. So we talked about different races and ethnicity that may be impacted by like, for instance, if you're belonging to a certain race or a certain ethnic background, you may have different life expectancies, you may have different health outcomes. So this is ingrained in our culture. Men and women experience different health outcomes due to differences in biological factors, societal norms and expectations, and access to care. Geographic regions, again, if you're living in a rural area, you may have low socioeconomic status, low education levels, low economic progresses. Disability, so if there's a person who's disabled, they may have been victim of discrimination, stigma, physical and social barriers to healthcare services. This should not be there if there's equity and equality within the system. Age, so older adults may experience high rates of illness and disability compared to younger population. So whenever you have people of extremes of age, you would want to focus more on them. Vulnerable groups in the society, we talked about homeless individuals, sex workers, vulnerable migrants. They may experience high rates of illness, higher rates of illness and disease, poorer health outcomes, and limited access to healthcare services compared to the general population. Inclusion health is a term used to describe the health and well-being of socially excluded populations, such as homeless individuals, sex workers, and vulnerable migrants. When you want to develop policies, you would want to include them. That is why it's called inclusion health. Vulnerable migrants, we've talked all about this, Gypsy, Roma, and traveler communities. It's very evident. Sex workers, discussing the influences on health determinants. So there's certain health determinants, the factors that influence an individual's health status. Some of them are social factors, such as access to healthcare services, quality of education. Then there are economic factors, environmental factors, behavioral factors, and genetics. So we talked about wider determinants of health. So the first core is the age, sex, and constitutional factors. There are individual lifestyle factors that influence them. Then there are social and community networks that have an influence. Then living and working conditions are interconnected with unemployment, water and sanitation, healthcare services, housing, work environment, education, agriculture, and food production. These are the general socioeconomic, cultural, and environmental conditions. So how inequalities of opportunity can impact the health and well-being of an individual? Firstly, they limit access to education. Secondly, inequalities of opportunity in employment. Thirdly, inequalities of opportunity in healthcare. Finally, there's social inequalities and marginalization. So I hope that's clear. I'll stop sharing this and I'll start sharing my last learning objective, which is LO4, and then we can start our assignment discussion, which is based on all these learning objectives. That is why I wanted to go through them. If there were more learning objectives, I would have taken more time, or I would have gone more faster. But I do tend to focus on revisions. So this last learning objective was focusing on understanding the implications of ethical and legal issues within the health and social care. We talked about ethical perspectives and approaches underlying decision-making, the ethical contexts, where we had informed consent, confidentiality, duty of care, autonomy versus paternalism, contemporary ethical issues and discussions, decisions such as euthanasia, pain relief, genetic engineering, cloning, organ donation, resourcing of health and social care. We talked about key legislations. We talked about policies and codes of practice. I hope you can see my slides. If I'm just talking on my own and you don't see my slide at any time, please let me know. We talked about what are the ethical perspectives in health and social care. So they're essential when we deal with sensitive issues that arise in the field. So they're principles of ethics that have autonomy, beneficence, and non-maleficence. You have justice, you have confidentiality, fidelity. So when we want to understand the implications of ethical and legal issues within health and social care, you consider patient safety, which has ethical and legal issues. You have trust and confidence, you have professional accountability, you have proper resource allocation, you have health disparities, where there's ethics and legal issues which can contribute to health disparities, where certain populations experience unequal access to healthcare services and outcomes. So healthcare providers and organizations must work to address systematic and structural issues that contribute to health disparities. We talked about informed consent. We talked about all of these definitions. So informed consent, confidentiality, duty of care, autonomy versus paternalism. So this refers to the tension between individuals' rights to make decisions about their own health and well-being and the responsibility of healthcare professionals to act in the best interests of their patients, which is known as paternalism. Euthanasia or pain relief, genetic engineering, cloning, organ donation, resourcing of health and social care. We talked about all these rights. I'm not going to go into details because this will be another session in its own. Human Rights Act 1998, Equality Act 2010, Care Act 2014, GDPR, safeguarding health and safety at work, storage and handling of substances, mental health and mental capacity. We talked about policies and codes of practice which help guide us. So they can, healthcare professionals can ensure that they are providing high quality care that is guided by professional and ethical standards and that respects the rights and dignity of all individuals. So we had the NHS Constitution, we had the Mental Capacity Act 2005, the NMC Code of Conduct, Social Care Commitment, the Children Act 1989, Adults with Incapacity, which is in Scotland, the Act in 2000, the Code of Ethics and Conduct for Social Care, Wales. So when you set standards of practice and ethical and legislative frameworks for practice, it's important. They're important components for ensuring high quality health and social care services. So you know that whatever you're doing is according to the standards. Setting standards for practice. So you establish professional bodies and organizations. You define the scope of practice for different professions. You can develop clinical guidelines and protocols such as the NHS. You establish accreditation and certification standards. You develop quality assurance and improvement programs, and you promote research and evidence-based practice. Then we talked about British Association of Social Workers, which was established in 1970. It aims to promote the highest standards of social work practice to advance the education and training of social workers and to represent the interest of social workers in England. It provides a wide range of services and resources for its members, including professional development opportunities, support for ethical decision-making, and access to research and best practice guidelines. Then we talked about Code of Ethics for Nursing and Midwifery Council. This code sets out the ethical and professional standards that nurses and midwives are expected to meet in their practice. It is based on 4 key themes. So they're prioritizing people, practicing effectively, preserving safety, and promoting professionalism and trust. Then we talked about the Royal College of Nursing, RCN. Their 9 principles included promoting professionalism and trust, prioritizing people, practicing effectively, preserving safety, promoting autonomy, collaborating with others, delivering person-centered care, improving health and well-being, and promoting learning and development. We talked about the key ethical and legal issues on health and social care. So they were informed consent, confidentiality, duty of care, autonomy versus paternalism. We've talked about this, mental health capacity, end-of-life care, resource allocation. The role of professional codes of practice within a health and social care setting were to ensure high-quality care, promoting ethical behavior, providing guidance on legal issues, supporting professional development, and enhancing public trust. These were the references. I am done with discussing all the learning objectives, and now I will be sharing with you the screen for your assignment discussion. Any questions, please let me know. Feel free to ask me and I'll answer the questions to the best of my ability. So, this unit is health and social care provision. The subject is social issues in healthcare. The code is 1385322. So whenever you're doing your assignment, please make sure to write this down, everything as it is. Write your student number, write the date, write your tutor's name. And so there are 2 questions, or there are 2 scenarios that you have to answer. You have to answer both the questions to the best of your ability. So too often there's a partnership that is just a bunch of people from different organizations who just happen to be present in the same room, giving the impression of dancing together while actually standing still. So sometimes the partnership is just a bunch of people who just don't do anything. It just appears that they're not doing anything. So if there's an individual who has a long-term health problem or several problems, and that person is unemployed, what would you do? Your task is to identify the key constituents that contribute to effective partnership working. Explain, so in this long-term health problem, and in this employment, what are the key constituents or the key factors that would contribute to effective partnership working based on this healthcare scenario? Explain the roles and responsibilities of 2 health and social care professionals working with this individual who will be working with this individual. So this is why I had asked you to do that assignment based on the roles and responsibilities of 2 health or social care professionals. So who will be working focused on this person with long-term health problems. They could have diabetes, they could have mental health problems, they could have obesity, they could have cancer, anything. Identify one piece of legislation related to equality and discuss its impact on service provision in this instance. So equality. So this person is disabled, for instance. So what would you have as an equal opportunity for this person compared to all others, because this person is unemployed? Although this person is having a long-term health problem and is unemployed, what would you do if you want to give one piece of legislation related to equality? I hope that's clear. That's the first question. So you have to answer both questions. The first question was this, and it has these 3 parts. The second question is health data. So there are certain health data that appear like There are 85,000, 8,50,000, sorry, 0.8 million people with dementia in the UK currently. There are 40,000 younger people with dementia in the UK. There are 25,000 people, sorry, with dementia from Black and minority ethnic groups in the UK. So this is health data. So you would want, what is your task? It is these 4 tasks you have. So your first task is to discuss the importance of data in health and social care planning for people with dementia. Then you would want to explain the influence of demography on service planning, and delivery for dementia in the UK. Then you would discuss the influences and explain the inequalities in service provision in your practice area, in this practice area. And then the last task is to explain the role of professional codes of practice and further discuss the key ethical and legal issues on health and social care. This is an essay that you would want to write. It would show evidence of a wide range of research and demonstrate correct citation and referencing techniques. So you would want to use ideally 5 references, which are Harvard referencing. You have all the links for Harvard referencing are there on Moodle. So with this first question also, when you're answering your questions, you would want to reference when you're answering these questions, even with the second learning objective with the second task. So a bit about how do we assess you in this context. So you should be able to understand how health and social care provision is measured. This is to discuss the importance of data in health and social care planning, explain the influence of demography on on service planning and delivery. You should be able to understand the roles of health and social care practitioners. We're going by learning objectives. This was the nutshell, where when you're understanding the roles of health and social care practitioners, you would explain the roles and responsibilities of at least 2 named health or social care professions and identify the key features of effective partnership working. Your third learning objective was to understand inequalities in health and social care determinants, where you were discussing discussing the influence on health determinants, and you were explaining how inequalities of opportunities can impact on health and well-being of an individual. This is one of your assignments as well. And number 4 was understanding the implications of ethical and legal issues within the health and social care. So here you were discussing the key ethical and legal issues on health and social care, and to explain the role of professional codes of practice within a health and social care setup. So that's it from my side. Any questions? If there are any questions, please let me know. Okay, so just opening the calendar. So it's the 24th of August that we're discussing this assignment. So you have September. So the 7th of September, your assignment should be ideally submitted by the 7th of September. So if you have questions, please let me know. It's always best to, when you're answering your questions, make sure that you have this assignment brief. Just copy paste it. And when you're doing this, this should be in bold headings. And then below this, then you would want to give your, you could always use subheadings. So subheadings are very effective because they help the person who's reading your assignment to navigate through your work. It gives them a quick idea of what you've actually written. They don't have to go through every nitty-gritty of it. Any questions? Okay. If there are no more questions,
Sorry, please, I have.
yeah, sure.
Okay. So my first question is that in research assignment, we are going to do it in a research form, like how we are going to do introduction and abstract. Is that how we are going to do it?
Can you repeat your question? Sorry, my speaker wasn't working well. Yeah.
So my question is that you see this one is the questions that we are answering, but in answering the questions, are we supposed to make it in a form of a research? Like
In the
we
form of
have
a what? Sorry.
a research.
Yeah,
So
yeah.
are
In
we
the
have
form of a yes. So in the form of a research, it's not a project, but it's you would want to use referencing in your answers.
so should we make it like a report form? Is that what we can do?
It's not actually a report. It is a report, but it's more discussion. So if I start, is my screen shared? So if I share my screen, see, there's a difference between, it's like an essay, actually. So your first task was, when you're talking about partnerships, you would want to identify key constituents that contribute to effective partnership working. It's not a report, it's just an essay that you were describing. So identifying you'll ideally use less words when you're identifying, but when you're explaining something, you would want to express it more. Okay, so you're explaining, you're talking more about this thing, and then you're identifying one key practice, a piece of legislation related to equality and impact, and it's discuss its impact. So when you're identifying, it's going to be short, but when you're discussing, it's going to be longer, and you can use different referencing also in it. You're discussing its impact on on service provision in this instance where we talked about long-term health problems. And then again, in health data, you're talking about importance of health data. So it's not a report, it's just the importance. You can give headings. So this, like, let's say you're giving a heading about quality of life. So the importance of data regarding quality of life. And then you can give a description, because it's discussion here in the first point. So you'll want to discuss more. Even in the second bit, it's explaining, so that will take more of your time. In discussion, explaining, describing is shorter, but discussions and explanations are longer. But it's not in the form of a report. Actually, it's an essay. But you would want to use referencing. That is why this word research is written. You would want to use referencing here.
Okay. Because what I get confused is that the first assignment you gave us about the mean mode, and you told us to do it in a word form. When I submitted it, I got an email from Raman
Yeah,
telling me
Raman
to.
Singh. Yeah, I
And
read that email. Yeah.
I was so confused and I didn't know what to do.
Yeah, if you have more confusion, you can always call them back and then ask them. This is the best I can explain you. But if you want more thorough explanation, I'm always happy to do it with them.
So does it mean that the